All right, continuing with the appendicular skeleton. All right, we can see the tibia, which is the thicker bone, and that is also called the shin. And this sits medially in the body. And we have the fibula, which sits laterally in the body. And the fibula is fine or thin. So fibula, lateral. Now, the proximal end of the fibula appears more blunt or flat. The distal end of the tibia comes more to a point. This would be called the lateral malleolus, which again then reminds you that the fibula sits laterally in the body. Okay, so for the fibula, you need to know that it sits laterally. You have your head, which is the proximal end, and the lateral malleolus, which is the distal end. Okay, we're going to move that out of the way now and just deal with the tibia. All right, so we're looking at the anterior surface of the tibia. And if we look at the proximal end of the tibia, you can see this little knot right here. This is the tibial tuberosity. Okay, if you feel right below your knee, you can feel your tibial tuberosity. And we now know that that has to face anteriorly. If we go down to the distal end of the tibia, we can see this little structure right here, which is the medial malleolus. And that tells you again that the tibia sits medially in the body. Now we're going to use this to determine right from left, and we'll come back to that in just a little bit. All right, if we go all the way up to the proximal end of the tibia, back to where we can see the tibial tuberosity, we can also now see the medial and lateral condyle. Okay, so I'm going to use that medial malleolus as my landmark, and that tells me that this whole side is medial, and then this whole side is lateral. So this is my medial condyle, and this is my lateral condyle. All right, so medial condyle, tibial tuberosity, lateral condyle. All right, so now to determine right from left. All right, so this is my anterior. My tibial tuberosity faces forward, and then my medial malleolus has to face medially on my body. So this would be my right tibia. Now let's pull in a left tibia. And again, we can see that tibial tuberosity, and there's that medial malleolus, which now needs to face medially in the body. Now, another way to look at these medial malleolus, if you look down at your ankles, that inner ankle bone that we always think about, that's actually your medial malleolus that you're feeling. Okay.